My name is Geoffrey Young. I just finished a general surgery residency in New Jersey at UMD&J. And other than my experience during residency in the emergency room, I had no practical urgent care experience. And so I was looking for a job to do this summer while I was doing some research and had some time. And it turned out that this was in the vicinity of one of my family's homes, and that there was an opportunity for me to be here for the summer.
So I guess you must like the change being at the beach. I assume you were probably at Ocean City as a child too, so did that influence your decision?
Yeah, it was always nice to be able to come back to the beach where you grow up and be able to spend time with family and enjoy the beach and also be able to work.
So tell us, how was the, I know you said you hadn't done urgent care for a while, so it must have felt a little awkward. How was the training program here, and how did that help you to ease into it?
The training program was very thorough. Dr. Young spent a lot of time with me going through a very thorough training manual that had most of the information that was needed. In fact, there were several times while I was working where I needed to find a piece of information, and I was easily able to reference it in the manual. The 3 to 5 day training was very extensive and went through almost all the most commonly seen things, it was very helpful, especially for someone like me who hadn't had any practical urgent care experience, to feel comfortable coming into the setting.
That's great. You picked that really well, and then I know we also had the doctor work with you also the first few days to make sure that you understood the paperwork or any procedures or all those other miscellaneous things that they never teach you in residency, right?
That's right, and they were very helpful. The physician staff was immensely helpful the first couple of weeks when I was working with another doctor. They were always willing to help me look at x-rays that I might have a question on, or if I had a childhood illness that I hadn't seen since medical school, they were able to join in. And then Dr. Gong's always available on the phone call or on the phone for any questions. It's just a call away. And the other support staff here, the med techs and the office staff, everyone is extremely friendly and helpful and knowledgeable. And all of the procedures, from starting IVs, drawing blood, splinting, and even with some of the more complex lacerations that I had to do, were very good in assisting me to do what I needed to do to help the patients.
How did you find the physician assistants? Many of them had many years of ER experience. Did you find them useful?
Yes, I worked with one physician assistant more than the rest, and he had an extensive amount of ER experience and was very, very helpful, especially during the busier times of the summer. Some of the busier holiday weekends, definitely.
Now, I know you were also working at Hopkins, and by the way, we actually benefited a lot from your experience. That was a good thing about meeting other people from other disciplines. We got a lot of the benefit of your ENT experience in general surgery, so thank you very much. But I know you were working at Hopkins a little bit too, and then coming back here to work here. Did you find that too hectic, or were you still able to relax and have a flexible schedule and enjoy the beach?
I was on a research schedule at Hopkins, and I was able to enjoy the beach and still be able to work and help pay off some of those medical school loans and had accumulated. And so that was very, very, very good to have the kind of flexibility to work and there and here, and also enjoy the time in between.
Great. Well, thank you very much, Dr. Young. We hope to see you back again next summer, and thanks a lot.
I definitely look forward to it.